Cholinergic receptors can be divided into two major groups: the muscarinic cholinergic receptors and nicotinic cholinergic receptors, right? So muscarinic receptors are actually G protein coupled receptors, and they act through second messengers. They are divided into 5 subtypes, right? M1 through M5, and they are found mainly in the heart, smooth muscles, brain, exocrine glands, and on sweat glands, right? The nicotinic receptors are ligand-gated channels allowing efflux of potassium and influx of sodium, and in some cases, calcium. Nicotinic receptors are of two subtypes. We have nicotinic neural, right? So these ones are found in autonomic ganglia and in adrenal medulla, right? And we have nicotinic M for muscle, right? So these ones are found in the neuromuscular junction of skeletal muscles, right? So cholinomimetics, these drugs, they have like same effect as acetylcholine, right? So let's just go through a synthesis of acetylcholine and then the action of drugs, right? So acetyl-CoA, the central metabolite, combine with choline to form acetylcholine in the presence of the enzyme choline acetyltransferase, right? So acetylcholine will be pegged into vesicles, right? And these vesicles will fuse with the presynaptic membrane in presence of calcium, right? Releasing acetylcholine into the synaptic cleft. So upon entering the synaptic cleft, acetylcholine has two pathways, right? So firstly, it stimulates its respective receptors, right? Nicotinic receptors and muscarinic receptors, thus a transmission of impulse, right? But acetylcholine is normally cleaved by acetylcholine esterase, right? So it cleaves it into acetyl and choline, right? So this acetylcholine esterase is the one responsible for reducing the concentration of acetylcholine at this place, right? So cholinomimetics will be divided into two groups. Direct cholinomimetics have same effect as acetylcholine, right? They stimulate nicotinic and muscarinic receptors. Indirect cholinomimetics will stop this enzyme, inhibit acetylcholinesterase, right? So if you inhibit this enzyme, it means the amount of acetylcholine in the synaptic cleft will be high, right? So in this video, we are going to focus on direct cholinomimetics, and we are going to cover aceclidine, Bethanechol, Carbachol, Methacholine, Pilocarpine, Cytosine, Lobeline, and Varenicline, right? So in front of every drug, I wrote like the receptor, right? So aceclidine, Bethanechol, Carbachol, right? So M is mainly muscarinic, right? So Carbachol has both effects on nicotinic, but mainly muscarinic. Then cytosine, Lobeline, and Varenicline are specifically nicotinic, right? Okay, so let's cover them one by one, starting with aceclidine. Aceclidine is a synthetic preparation administered subcutaneously, intramuscularly, or tropically, thus eye drops, right? That's the main way, right? So this drug is not toxic and it does not cross the blood-brain barrier, right? The main indications, because I already told you eye drops, right? So the first one is glaucoma, right? And it can also be used in atonia of large intestine and urinary bladders. Next is Bethanechol, right? So Bethanechol, usually there is it's also called Uroton, right? So Bethanechol activates bladder smooth muscles, right? This drug is resistant to acetylcholinesterase, meaning to say it's not destroyed, it remains high in the synaptic cleft, right? This drug does not have nicotinic activity, yes, and the main indications, as I said, I only mentioned the mechanism on bladder, right? So mainly urinary bladder retention, but you can also use it in post-operative and neurogenic ileus, right? So there is this mnemonic, it says Bethanechol, right? Bethany, call me to activate your bladder. Bethany, call me to activate your bladder, right? Is Bethanechol, right? Okay, the next one is Carbachol, right? So Carbachol is a carbon copy of acetylcholine, but again resistant to acetylcholinesterase, right? It's a carbon copy. It's like the exact, it is exact structure. Right, this drug constricts pupil and relieves intraocular pressure in open-angle glaucoma. All right, so that's all about Carbachol. The next is Methacholine, right? So methacholine is mainly used in diagnosis of asthma, right? As methacholine challenge test, right? This drug will stimulate the muscarinic receptor in the airway when inhaled. Right, so if you look here, this is the normal structure of bronchial, right? And you can see in asthma, there is excess mucus, there is this narrowing, right? So if you give the methacholine, there will be a certain degree of dilation, right? So this is what happens. You are testing someone you are suspecting to have asthma, right? The person is coughing, wheezing, but this patient is, if you check the pulmonary function test, right, they are like normal. They are normal, but you want to make sure that this is exactly asthma. Then you do this this challenge. The next one is pilocarpine, right? So pilocarpine is an alkaloid from Pilocarpus pennatifolios, right? So this is the plant, right? So that's where it comes from. It's resistant to acetylcholinesterase, and this drug is toxic if used systemically, right? So it's mainly used as eye drops, right? 1 to 2 drops in each eye, 2 to 4 times per day. We can also use it as an ointment, right? In this form, you lay it behind the lower lid 2 to 4 times per day, right? This drug contracts the ciliary muscle of the eye in open-angle glaucoma and the pupil sphincter, the sphincter pupillae, in closed-angle glaucoma. Pilocarpine is resistant to acetylcholinesterase and it can cross the blood-brain barrier, right? So it's a tertiary amine. Main indications is a potent stimulator of sweat, tears, saliva, right? So we can use it in open-angle glaucoma. We can also use it in xerostomia, right? In a dry mouth, right? But yeah, it's rarely used. Right, so pilocarpine here on sweat, you need to know in diagnosis of cystic fibrosis is the one which is used, right, in diagnosis, right? Then now let me just go through the last drugs, nicotinic cholinomimetics, right? Cytosine, Lobeline, and Varenicline, right? So these drugs stimulate the nicotinic cholinereceptors in zona carotis and initiate a reflexive increase in respiratory and vasomotor centers, resulting in short stimulation of breathing and elevation of blood pressure. They also stimulate the N cholinereceptors in the adrenal medulla that will increase the secretion of epinephrine, which causes vasoconstriction and elevation of blood pressure, right? So now you know the main effects here. Vasoconstriction, increasing blood pressure, right? And stimulation of respiratory center, means there will be increased in what breathing rate, right? So Tabix, right? Tabix is the other name for what cytosine, right? And this cytosine is mainly used in respiratory arrest, and we can use it during collapse, right? Because it increases blood pressure. Lobeline, we use it in a respiratory arrest. We can also use it in asphyxia in newborns, but we do not use it in collapse because it is a transient decrease in blood pressure, right? So we don't use it in collapse. Varenicline, right? So these drugs, all of them are used in tobacco users, right? So they are used against the tobacco use or tobacco abuse, right? Okay, right. So these are main side effects of these drugs: hypersalivation, abdominal pain, diarrhea, bronchial spasm, bradycardia, frequent urination, and sweating. Thank you so much. If you like this video, please make sure you give it a thumbs up, leave a comment in the comment section, and don't forget to subscribe. Until next time.